welcome to the channel Dewdear Academy. In this video, I have included the question paper discussion, that is Sree Chitra Institute for Medical Science and Technology Staff Nurse Examination, and this examination is conducted in 2015. So I have already uploaded 3 videos and this is the 4th video. So I am discussing the question numbers from 61 to 80 questions. So please watch the video, and also those who have not subscribed to the channel, please subscribe it. So now let me start the questions. Question number 61. In the assessment of a client with Guillain-Barré syndrome, nurse gives high priority to. Options are pain, level of consciousness, motor functions, respiratory status. So in the assessment of a client with GB syndrome, the nurse gives priority to. Options: pain, level of consciousness, motor functions and respiratory status. So here the correct answer is respiratory status. Option D is the correct answer. So this question is from the nervous system. So this is very important to study all these neurology conditions when you are preparing for this exam. So it is very important to give priority to the respiratory status in assessment of the client with GB syndrome. The next question: which one of the following is an anticonvulsant drug? Which one of the following is an anticonvulsant drug? Bromocriptine, large-actil, phenytoin, chlordiazepoxide. So, which is the anticonvulsant drug here? Option C, phenytoin is the anticonvulsant drug. Okay, so this is also a neurology section. The question is from the neurology. Phenytoin is an anticonvulsant drug. Then, perception in the absence of external stimuli is termed as. Options are delusion, illusion, phobia, hallucination. Perception in the absence of external stimuli. In question number 63, the correct answer is option D, that is hallucination. Okay, the perception in the absence of external stimuli is known as hallucination. In the presence of external stimuli, it is known as illusion. So try to understand the difference. Perception in the absence of external stimuli is hallucination, and perception in the presence of external stimuli is known as illusion. Then question number 64. 1 tablespoon is equal to dash ml. 1 tablespoon is equal to how much ml? Options are 5, 10, 15 and 30. Correct answer is option C, 15 ml. 1 tablespoon is equal to 15 ml. Then question number 65. The physician prescribed 1500 ml RL ringer lactate to be infused in 12 hours. 1 ml is equal to 15 drops. The drop rate would be. Options are 20 drops per minute, 25 drops per minute, 31 drops per minute and 35 drops per minute. So this is very important to study the formula to find out the drip rate and rate of fluid calculations and all. That is very important. So here the correct answer is option C, that is 31 drops per minute. Option C is the correct answer, 31 drops per minute. Then question number 66. The physician prescribed phenytoin 0.2 gram orally twice daily. The medicine is available as 100 mg capsule. How many capsules will be administered for a dose? The physician prescribed phenytoin 0.2 gram orally twice daily. The medicine is available as 100 milligram capsule. So how many capsules will be administered for a dose? So here the answer is 2 capsules. Option B is the correct answer, 2 capsules. Then question number 67. During CPR of an adult client while performing the chest compressions, the sternum will be depressed to. Options: half to 3/4 inch, 3/4 to 1 inch, 1.5 to 2 inches, 2.5 to 2 to 2.5 inches. So during CPR of an adult client, how much the sternum will be depressed when performing the chest compressions? So the correct answer is 1.5 to 2 inches. Option C is the correct answer, 1.5 to 2 inches for adult clients. The next question. In which one of the following situations the rescuer uses jaw thrust method to open the airway? Options are in all situations requiring CPR, if the client has a history of epilepsy, if the client has a history of head injury, if the injury of the neck is suspected. When to perform this jaw thrust method? Yes, the correct answer is option D. D is the correct answer if the injury of the neck is suspected. So in case of any spinal injury or if there is injury of neck suspected, jaw thrust method is used to open the airway. Then question number 69. Which of the following assessment data is relevant for a client diagnosed with glaucoma? History of diabetes mellitus, history of migraine, history of chronic sinusitis, history of bronchial asthma. So which of the following assessment data is relevant for client diagnosed with glaucoma? The correct answer is option A, that is history of diabetes mellitus. Then question number 70. A nurse monitoring the intercostal drainage system of a patient with pneumothorax notes intermittent bubbling in the water seal chamber. The most appropriate action would be, the nurse monitoring the intercostal drainage system of a patient with pneumothorax notes intermittent bubbling in water seal chamber. What does this indicates? If there is intermittent bubbling in water seal chamber. So in case of patients with pneumothorax, if there is intermittent bubbling, that can be considered as normal. So the options are inform the physician, check for air leakage, document the observation, clamp the chest drainage tube. So here the correct answer is option C, that is document the observation. Okay, document the observation is the correct answer. If there is continuous bubbling, that indicates air leakage, so that has to be considered. But here in question it is asked intermittent bubbling in case of patient with pneumothorax. Okay, so pneumo means air. So in such cases, if there is intermittent bubbling, that is normal in case of patients with pneumothorax. So just document the observation is the answer. Then question number 71. The arterial blood gas ABG report of a client shows pH of 7.32, PCO2 52 millimeters of mercury, PO2 85 millimeters of mercury, and bicarbonate of 27 milliequivalents per liter. The nurse interprets that the client has. Options are respiratory acidosis, metabolic acidosis, respiratory alkalosis, and metabolic alkalosis. Answer is respiratory acidosis. In this question, the correct answer is option A, respiratory acidosis. Then question number 72. While monitoring a child after tonsillectomy, the nurse observes him swallowing frequently. So this indicates that the child is. Options are feeling thirsty, recovering from anesthesia, bleeding, having pain. So here after tonsillectomy, if the patient is having swallowing frequently, that is indicating bleeding. So option C is the correct answer. The nurse is reviewing the laboratory values of a patient scheduled for surgery. So which one of the following result is unfavorable? So several lab values are given here, and which among these result is considered as unfavorable in case of a patient scheduled for surgery? Options FBS 84 milligram percent, HB 8 gram percent, serum creatinine 0.7 milligram per deciliter, and blood urea 28 milligram per deciliter. So here the most unfavorable result is HB 8 gram percent. Okay, HB 8 gram percent is the unfavorable result among these lab values for the patient scheduled for surgery. Then question number 74. Which one of the following statement is incorrect about Glasgow-Coma scale? Options: the scale measures the neurological status, the sensory responses are easily assessed, the maximum score is 15, a score less than 8 indicates coma. So which one of the following statement is incorrect, or which is the false statement regarding this Glasgow coma scale? So correct answer here is the sensory responses are easily assessed. So this statement, option B, the sensory responses are easily assessed. This statement is incorrect about Glasgow coma scale. Then question number 75. The site selected by a nurse to administer an intramuscular injection to a 6-month-old infant is. The site selected by a nurse to administer an IM injection to a 6-month infant is. Options are vastus lateralis, ventrogluteal, dorsogluteal, deltoid. So here the answer is option A, that is vastus lateralis. Vastus lateralis is the correct answer. Option A is the correct answer. The site which is used for IM injection to a 6-month-old infant, the answer is vastus lateralis. Then question number 76. Which of the following age group children engage in parallel play? Options are infant, toddler, preschooler, schooler. Correct answer is option B, toddler. So these questions are from pediatric nursing. So which age group children engage in parallel play? The answer is toddler. Then next, in which one of the following conditions Kernick's sign is considered as a positive indicator? So which is indicating that Kernick's sign as a positive indicator? Options are meningitis, hepatitis, deep vein thrombosis, typhoid. So in which of the condition Kernick's sign is considered? Answer is option A, meningitis. So this is again from the neurology. Then question number 78. Which one of the following is the most potent stimulus for erythropoietin production? Options are anemia, proteinuria, hypoglycemia, hypoxia. Which one of the following is most potent stimulus for erythropoietin production? The correct answer is anemia. Anemia is the stimulus for erythropoietin production. Then one of the major complications that occur during hemodialysis is. Options are muscle cramps, hypotension, air embolism, pulmonary edema. One of the major complications that occur during hemodialysis. The correct answer is hypotension. Hypotension is the major complication that occur during hemodialysis. The next question, the letdown reflex during breastfeeding is influenced by the hormone. The letdown reflex during breastfeeding is influenced by the hormone. Options are progesterone, estrogen, prolactin, oxytocin. Progesterone, estrogen, prolactin, oxytocin. So the letdown reflex during breastfeeding is influenced by oxytocin. Okay, oxytocin is the correct answer here. So with this, I have included all the questions, 80 questions of this Sree Chitra Institute for Medical Science and Technology, Trivandrum, this examination. So I have included all the 80 questions and it is uploaded as 4 videos. So please, all those who are preparing for this examination, you can watch these videos and you will get an idea of which are the important areas which you have to concentrate more when you are preparing for the exam. So thank you for watching this video.